woman is in critical condition at Tampa General Hospital. She's being treated for burns, relatives tell us, following a fight with her boyfriend. According to St. Petersburg police, the victim, Sharon Pasco, suffered those burns at a home on 24th Avenue South. Pasco's uncle tells News Channel 8 she was arguing with her boyfriend, a man named John Riggins, when things escalated. The uncle claims Pasco came running out of a back room already on fire, and that's when he and another family member rushed her to the bathroom.
Get her to the shower, get her to some water, so we got her to the shower and turned the shower on her. Because she was engulfed in flame from her feet all the way up to her, was shooting above her head.
The uncle tells us Riggins tried to help put the fire out before he took off. Police found him hiding in an abandoned house next door. Riggins himself is recovering from burns to his arms. Investigators have not yet confirmed if he set Pasco on fire, so at this time, no charges have been filed yet. Now, burns like the one suffered by Sharon Pasco can be the most painful injury a person can endure.
Yeah, recovery can take years with many painful surgeries and perhaps a lifetime of living with debilitating scars. Peter Bernard is live at Bayfront Health, St. Petersburg. So, Peter, what kind of treatments lie ahead for this poor victim?
Josh, it's really bad. With burns covering over 80% of her body, she's most likely going to have a dead tissue removed, and then doctors will begin the process of replacing her skin.
Pictures of burn victims aren't pretty. Exposure to heat and flames can cause skin to peel and bubble. Later, patients can find their limbs start to constrict, pulling tighter, making movement difficult.
That usually kills the nerve endings.
Dr. Jeffrey Johnson, trauma surgeon at Bayfront Health St. Petersburg, worked in the battlefields of Iraq and Afghanistan, treating war injuries. He tells me treatment can be a long process.
The recovery can be year-long, maybe 2 years. It can be lifelong, for the psychological recovery associated with that.
There are two burn patients in the St. Petersburg case, Sharon Pasco and her boyfriend, John Riggins. Riggins has extensive injuries to his arms with heat-related blisters, but what you can't see could be much worse.
A lot of times the burn you can see on the outside of the body is easy to diagnose, but if there's an inhalation component where they have breathed in hot gases, there can be a burn inside to the lungs.
Ahead for Pasco and Riggins could be skin grafts done in stages over the course of several months.
Sometimes we cover that with various types of artificial skin components, or eventually we like to use the patient's own skin.
Or cadavers. Complications can include inflammation, infections, blood loss, and scarring.
It's not unusual to have patients in physical therapy and getting various forms of burn wound care for a year, 2 years after a burn.
Dr. Johnson tells me some burn patients actually have such severe injuries, their nerve endings are dead, so they don't suffer as much, and it's kind of ironic. If you have less of a burn injury, those are the people that suffer the most. Jen?
Well, and Peter, I've done these stories before about these burn victims. Modern medicine has really helped make some advancements in terms of survival, right?
Right, that's the good news in this story, that they're saving a lot more people, a lot more of these burn victims, but good critical care in the early stages is critical.
As it is with many injuries. Peter Bernard, live in St. Petersburg for us tonight. Thank you, Peter.